Hi, I'm Dr. Mohan Thomas. Today is World Health Day. Never in the history of mankind has health been more important as in present times. As we know, some countries are going through a second wave of COVID. Enough said. I decided I would take this opportunity to discuss with everyone watching the importance of knowing the procedure that you're going to be going through, the complication rate, why does it happen, and what you should not do. Everybody's heard of a procedure called Brazilian butt lift. What is a Brazilian butt lift? It's taking large amounts of fat, some people more than others put more fat into the butt area. And one of the, how should I put, brand ambassadors for this excessive projection of the butt is Kim Kardashian. And so she remains a sort of a idol for Brazilian butt lift. The procedure is a very dangerous procedure, extremely dangerous and even more dangerous in the hands of novices and amateurs. We have an organization called World Association of Gluteal Surgeons, and we have a task force. When we did our research, we found that the incidence of death, mortality, is very high, almost as much as 1 in 3,000, according to some numbers. Now, why does this happen? It happens because not knowing the fine points of this procedure, fat is injected in the wrong plane or finds its way into a major vessel in the gluteal area, the butt region, goes straight to your heart or your lungs, and you have what is known as APE or pulmonary embolism, and even massive ones going into the heart as well. And there's nothing you can do. Death occurs within minutes. So people go around beating their drums about gluteal surgery and how it's important. Now, the worst thing you can do, take such high-risk procedures and go to distant countries and have their work done, and unfortunately for that person, die in that country. I believe, I'm a strong believer, that you should have surgeries done in your own country. Whenever you have to travel more than 4 hours, that itself is a risk. Now, I'm talking of particularly invasive surgery. Having said that, people seem to have a romance with costs. And particularly in the Indian scenario, we love bargains. And so you may get something you didn't bargain for. The most important thing you can do for yourself is choose the right surgeon, not based on cost. Now, one would go and sit in a 5-star hotel and you expect to pay, a fast food price. It's not going to happen. So if you don't value a life, then life means nothing to you, results mean nothing to you, safety means nothing to you, then go for it. Go with a cost factor. Now, I am leading up to something. I'm leading up to the fact that in the last 18 months, there has been global incidences of death of almost 20 plus patients. How valuable is a life? Do you think it's worth saving $4,000 or $5,000 or 50,000 rupees to go to some place that's really not equipped to handle an emergency? For Brazilian butt lift, there are some safety points that you must follow. And if you have not been part of a task force, not listened to it, you would never know what it is. When things look easy in the hands of a barber, it's because he's skilled. He knows what to do. Shouldn't he at least make the same effort in choosing a barber as in choosing a surgeon? You require to be in the perfect space. You require to follow some guidelines. You need to have high-tech equipment to make sure you track the fat that we put in. We have a navigation system. A lot of people use a lot of navigation system, but we're the only people in India having a navigation system, real time. not to mention the other safety factors and standard operating protocol that we have in place. I want to bring your attention to something that happened recently in the last few days, a very sad incident. Now, this is Joselyn Cano. Joselyn Cano was a famous model and an American influencer. She died. She underwent a BBL or Brazilian butt lift. Look at her. What a pretty girl. I don't even know why one would want to go. After this, she went ahead and had another butt lift done, a Brazilian butt lift, and she died. May her rest, or rather, let her soul rest in peace. A great loss to the family, a shocker to the world, and look at this girl in the prime of her career. One might think, who is to blame? I think, I always believe one must take onus for one's action. But equally responsible is the surgeon who should be in a position to tell people, hey, you know what, you already have a large gluteal area, a butt region, you don't need any more. And go through the risks and make her understand what needs to get done. If I see 10 patients, I turn away 6 of them because body dysmorphic disorder is a very real thing. The most common organ or part of the body that people are obsessed about and have body dysmorphic disorder is their nose. That is the reason why we have a large number of reoperates with noses. People think it's a very small little thing, and itsy bitsy nose, anybody can do it. You can't do it. You have to be experienced, skilled, and have artistry. This is not a common denominator. Everybody that goes through training doesn't have the same skills, nor the experience, and experience really matters. The next most common body dysmorphic disorder, particularly young men between the ages of 18 and 25, is gynecomastia. And they sometimes confuse gynecomastia with puffy nipples. Now, it is very important you weed these people out. We have an in-house psychiatrist who we use to make sure people don't have body dysmorphic disorder, and more importantly, unrealistic expectation. If you want to be successful, be safe, put smiles on people's faces, you must be able to weed these people out, make sure you say no to them. Otherwise, you'll have a slew of disasters. When people line up to places that are cheap and they don't even clean the operating rooms in between cases, if you get an infection that is probably going to linger for a while, disfigure you, even cause death to you, if you don't heed these warnings, I don't know what can make you wake up. Maybe if a stone falls on your head, you might wake up. Ladies, gentlemen, boys and girls, medical colleagues and surgical colleagues, you will all agree that a life is priceless. Please be careful and take the most amount of time to choose a surgeon. Now, I needed rhinoplasty when I was in the US. I went and saw a surgeon who was very nice to me. I was so poor, dirt poor. I certainly didn't have the money. So I left and I saved up the money. Took me 4 years. I saved up the money, and the surgeon was nice enough to do it for the same fee that he mentioned a few years ago because I was a struggling student. That's how doctors should be. And I decided that no matter how much it cost, it would take me a few years. I saved up and went to a good surgeon who executed the job perfectly, and to this day, I'm very happy. I hope you are able to take some message home. As surgeons and as patients, have a great day. Take care of yourself.